I started looking to partner with HDA and programs like this 6-9 months ago, start thinking about it because we started getting into programs where we wanted to look at our clinic patients and their wellness and try to prevent the major causes of death and major causes of altered lifestyle in the best way we could. HDA gives me so much new information that I usually don't have on my patients that helps me tremendously. Things like looking at the arteries, the ultrasounds, echocardiogram. These are things that I don't always have during a wellness exam. And so this was giving me really good information. And I will say that now that I'm seeing patients and going through their wellness exam and their blood tests and adding in the analytics information, I am feeling so much more comfortable when I'm seeing a patient that I really understand what their health is now and what needs to be done to keep them healthy, living longer, and preventing things that will alter their lifestyle. It's really given me a really good, confident feeling with my patients to be able to do that and then make the recommendations that I think will help them. As you might anticipate doing these tests, you're going to find things that you didn't expect in those patients that need to be looked at. So it alters directly what I do. We had one 2 weeks ago where I was in my office seeing patients, and they came down to show me aorta that was over 3 centimeters in diameter. That's aortic aneurysm. This is a long-term smoker who has never listened to me for 20 years about stopping. He just turned 60. And now he's got an aortic aneurysm that was giving him no symptoms whatsoever, and he's going to have surgery to correct it. So some things come up immediately that need to be done. Other things come up. Patient this morning, his tests were pretty good, but he's 49 years old. Cholesterol's borderline high, maybe not meeting the standard of care for a statin drug to treat him. But now it comes back at the age of 49, and he's got plaque in his femoral arteries on both sides. Okay, so my 49-year-old patient is developing plaque already that we're identifying. And so instead of just saying, well, you need to lose 10 pounds, you need to eat healthier, he's now on a good dose of a statin drug because I want his cholesterol much better controlled. I'm looking at his heart with a calcium CAT scan score to see if there's plaque in the arteries in his heart also. But I'm getting much more aggressive about doing things that will help prevent more plaque from developing, since we're already seeing it, and maybe over a long period of time help him reabsorb some of those plaques that he is getting already at his young age. I am feeling so much more comfortable when I'm seeing a patient that I really understand what their health is now and what needs to be done to keep them healthy, living longer, and preventing things that will alter their lifestyle. It's really given me a really good, confident feeling with my patients to be able to do that. Positive feedback that I'm getting from me, since I did it myself, and from patients. I did it to see if this was a real program that I liked, that I thought was really good, and would my patients like it? Because initially the early patients were saying they loved it, and I thought it was a really good program. And at my age, I got through, and it didn't say I was going to have dementia and die soon, so that was always nice. But it was very well done, and some of the data that I got actually had me change with my doctor some of my therapy to do some things a little bit differently. My patients love it. They all love it. They're telling all their friends. We're getting friends calling saying, oh, can we come? We're not a patient. We want to get this done. We want to get this done. So everyone is giving me very positive feedback. So it's going really, really well. And we might have to expand the program for future as we start promoting this to more patients in our practice and even people outside of our practice who have heard about it and want to be involved. HGA and my clinical staff have worked very well together. The employees with HGA Analytics and the employees in my office seem to be getting along very well. Everything seems to be running really smooth. There's not a lot of increased work. My employees are really excited to talk to our patients about the program, and then we don't schedule it. The analytics group do schedule it and get it running. And it also does add a little bit more income to our clinic in doing this program. So there is a benefit, and we try to do programs that are not only helpful for patients, but maybe can generate some income from the clinic to keep the clinic running the way it should be running. I've been taking care of patients with wellness exams for 50 years. And when I think about it now, I'm a strong believer in the hands-on physical exam. I do examine my patients top to bottom, looking for anything that might be abnormal. I still find things that are abnormal that need to be looked at. And I do blood tests. I'll do a CBC, a chemistry, a lipid panel, a urine, and STD testing. And then I thought, okay, what did I do 50 years ago as a young doctor? Oh, I did a hands-on physical, I did a CBC, a chemistry, a lipid panel, a urinalysis, and STD testing. Nothing has changed in 50 years at how we look at a patient for a wellness exam. And hey, now with analytics, we do ultrasounds of the arteries to look for plaque anywhere. We're looking at thyroid with an ultrasound. We're looking at your kidneys. And looking at tests like these is helpful in many different ways. Some people have cysts in their kidney that they're born with. 15% of people are born with cysts and nodules in kidneys, and now they're 60, 65 years old having abdominal pain, and we do a CAT scan and, oh, there's cysts and something in your kidney. Well, those were probably there forever. If we get an analytic program once a year on people, we already know that. We already know there's cysts there in the kidneys. We already know there's some nodules in their thyroid that are benign. They're not cancerous. They're not malignant. They're not that important. You don't need to worry about it. So as we get into looking at symptoms as people get older, we already know what's there from the wellness exam and the analytics exam, which is very, very helpful in evaluating new symptoms in people as they get older, but also in handling their wellness program to keep them healthier, longer, and living longer and having a better lifestyle as they get older. So I'm really very much enjoying having the input from the analytics, the new things I'm doing on wellness exams, the hands-on physical, and putting it all together and looking at my patient. It's giving me as their doctor a really good, comfortable feeling where they are medically and what needs to be done to keep them healthier, longer, and have a good life. I love this program so much that I don't want anyone directly competing with me here. But if I was really talking to someone about this program and they were interested, I would say, do it, get it going, set it up. It's worth it. The information that you get about your patients is just tremendous, and you'll love taking care of your patients and getting them into wellness programs when you're able to see the results of the tests the analytics does.